hate taking pain meds. And if I can, whatever I can do to take less, I'm going to do that. Right. And, is that something, do you think even, obviously hardliners are, you could tell them, whatever you think is, and they're going to say no. But I'm looking at it, trying to sell my doctor on the idea. It's saying that it'll help me go down on my opioids. Do you think that's a good way to approach it, or I just want to try it to see what it's like? I mean,
yeah. So I think, with anything, we've talked about this several times before on the show, is to present your condition with a set of goals. What are you trying to accomplish, right?
Right.
And in what way are you being limited? And how can the proposed treatment help you become unlimited and meet your goals? So yeah, marijuana. I said it. I'm gonna get a warning. This is gonna happen all night.
You won't. I will.
Oh yes, this isn't my account. Great,
No.
I can do whatever I want. So yeah, I mean, if lettuce is going to be a positive avenue to you getting from point A to point B, then sure, let's outline that process and get it done. Assuming it can be done in a legal and compliant framework. I'm going to keep coming back to that because I feel obligated in being in my position. Right. But yeah, I mean, the same thing when we talk about opioids or any kind of treatment, whether it's a procedure or medication, or other type of alternative therapy, right? What is it that we're trying to accomplish? And if you sell it in that sort of perspective, then it can make a lot more sense. If all you do is you come in and you say, hey, I want this medication, and you don't really give me any reason why, chances are you're not going to be very successful.
Yeah. And Forky brings up a really good point, that if you are thinking about going this route with your a med card, it's definitely more expensive than your $10 copay. Because chances are your insurance isn't going to cover the appointment for the clinic that gets you approved for the med card, and it's definitely not going to cover it when you go to a compassionate use dispensary. It definitely won't cover that at all. In fact, you can't even, in some of them, you can't even use a debit card, right? Your credit card has to be cash. Or if that's a debit card, it gets routed as like a cash advance or some kind of funky thing because of the banking statutes, right? So, so you get your doctor, and let's kind of get past the hardliner, right? The immediate, absolutely not. You'll shoot your eye out if you use medical cannabis or something like that. You get somebody in there, and they're somewhat, right? I think they're somewhat open to the idea. I think from my perspective, I got to educate myself on it. I need to know more about it than, no offense, I'm not going to say I know more about it than you as my doctor, right? I'm not going to say that, but I'm going to make sure I know more about it than you do.
Yes.
And I'm going to take that knowledge that I get and that you guys get from talking to other patients, talking to other invisibles, reading the right information. And y'all, Jamie is in here. If you have any questions, Jamie is a mountain of great information about this stuff. Send her a message. But I want to know, I want to take what I learned, apply it to me, how it can help me be better, and then find ways to get that information to you. Right? Does that make sense?
Yeah.
For me, it's, like I said, it's not a high, it's not a buzz that I'm after. It is taking less pain meds, right? It is. And as I posted earlier today on social media, it's worked. I know it's only one. I went from 5 to 4 pills, right?
What is that over a month?
Right. Well, it's 30 pills, right?